Dr. Abdul El-Sayed, welcome to the Climate Pod.
Yeah, thank you so much for having me, and thank you for shining a light on this critically important issue.
Well, we have so many critical issues to talk about in the conversation today. It's so great to have you on. And I want to ask you about, of course, a number of environmental and climate questions, because you've been written so eloquently and spoken so eloquently on a number of those issues as a public health official. But first, I wanted to just, if you don't mind, start asking you about yourself a bit. You know, you're a doctor, you're a public health official, you focus on epidemiology in your academic teachings. You're this prominent communicator in health issues, both as an author and commentator. And so you launched this remarkable podcast that I love called America Dissected last fall. And then all of this happens. And, you know, watching COVID unfold, I think for anyone, it's been tragic. It's been weird. It's been stressful. It's new for everyone. But I have got to wonder, being who you are, like, what has this been like for you?
Yeah. You know, on the one hand, I feel a bit like a general who missed the righteous war. You know, I as much as I value the work that I do in health communication and in trying to give people ownership of the science and an understanding of what's happening, you know, I can't help but wish that I was still running a response because, you know, that's sort of what you go to school and you train to do. And in the absence of that, a lot of my focus now is just trying to really get it right in terms of the communication, but also not to do so divested from the context within which we have to understand this. And you know, I as someone who is very political in my work, I come to my politics because of my belief in science and my recognition of what our society has to be like to take this on. And so the day-to-day has just been, you know, working as hard as I can to learn and understand, and then to share, both through the podcast, my work on CNN, and then in my writing in other venues and doing things like this. And so it has been a bit surreal. And in the times that I get to step back and think about how my own life has changed, I'm at once very grateful that everybody in my direct vicinity has been healthy, and for the most part we're together, but also just very mournful of the fact that, you know, we as a society, and particularly those who've been affected the worst, have had to go through this, and also committed to making sure that we build out the kind of politics and public infrastructure that allows us to say never again and mean it.
And what I love, I mean, this is in all your work, what I love is it's something you just mentioned is context. You always put it in great context. And this is what I've really admired as someone that cares a great deal about communicating the climate crisis, is how you talk about the climate crisis as someone who's worked in public health. Can you tell me a little bit about how you first got interested in wanting to talk about the climate crisis as someone that works in healthcare?
Yeah, I'll be honest with you, Brock. I'm an accidental environmentalist, and I say that because I had a really good friend named Ji-Sung Park, who's now a climate economist at UCLA, and we were in grad school together. He was one of my best friends in grad school. And I remember us having lunch, and he said, "You know, Abdul, you should really be more vocal and invested in the climate movement." And you know, at that point, it was the early 2000s, and you know, actually right before 2010, and everything I'd seen of climate activism had been centered on, you know, polar bears and melting glaciers. And I'll be honest with you, I'm not that passionate about polar bears. If I found one, I would run away. And melting glaciers sounds terrible, but you know, I feel like the things that I have always been so drawn to have been human suffering and what we can do to solve that. And so, you know, my retort to him was, look, there are babies dying, and I'm more focused on that. I don't care much about polar bears. And he said, you know, they're the same issue. And he was, of course, right. And I didn't appreciate that until I was working in the city of Detroit as health director. And we started to hear from folks in 48217, the zip code that's heavily affected by the pollution of corporations in that community. That, of course, is a vestige of the way that we pattern access to space because of redlining and racism. And folks were talking about asthma rates, and I was looking into this from an evidence perspective. And the thing that caught me is that we don't appreciate that all of the pollution that comes out of a corporate smokestack is filtered through the lungs of our children.
Yeah.
Before it goes and destroys our atmosphere to hit them back a second time and rob them of their future. And this is when I became an environmentalist, when I could connect all of the failings of what we are doing to our earth to what we are doing to our children. And I, had to call my friend Jisung and let him know that, I was from that day forth an environmentalist and he had won the debate. But we have to recognize that all of what happens to our earth happens to us. And even if you are privileged enough not to have to deal with the consequences of what corporations do to our air and water on its way up, you will definitively, you or your children or their children's children will have to deal with it on the way down. And this is what folks need to understand, that it impacts our lives and livelihoods in profound ways.
Oh, absolutely. And as COVID has unfolded, obviously, in the climate and environment movements, we've talked so much about air pollution. Has there been anything that you've learned as this pandemic has unfolded about air pollution that has surprised you, or anything new you've learned?
A couple of things. As an epidemiologist, we're taught to understand an epidemic, not just with respect to the agent, the pathogen that causes the epidemic, but to understand that a pandemic occurs because of an interplay between an agent and then a host and an environment. And if you want to understand who's affected the worst, you have to look at how the environment has been influencing people for a very long time. We've got a circumstance where COVID-19 is walking a path that is paved through the systematic oppression of a group of hosts by their environment over a long period of time. And to add insult to injury, more injury to injury, in communities like 48217 that have been hit hard by COVID-19, the Trump administration has used the excuse of this pandemic to stop enforcing basic Clean Air Act regulations. And so it's like we are letting the environment go haywire on people who are now having to deal with both the environment's insults on their well-being and the consequences of this virus at the same time. And it's criminal, frankly. And we cannot allow this state of affairs to keep moving this way in our country.
Yeah, and it leads to something that you and your co-author write a great deal about in Healing Our Politics, which is this feeling of insecurity. I mean, we often think about insecurity when it comes to the climate crisis. I mean, how do you see what is unfolding in our own environment just here in the United States, leading to a greater deal of insecurity that's going to manifest into a tougher political environment? That's a complicated question, but what are you seeing with the climate crisis that concerns you in this regard?
I'll be honest with you, just a very basic, simple thing. Even if you could care less about climate change, I want you to think about what happens when gas prices go through the roof, right? What happens when low-income people can't afford the means of getting around? That is a fundamental source of insecurity. The system that we have created to provide ourselves energy is so insecure because it relies on burning stuff that comes out of the ground into the lungs of our children. So not only does it make people sick, which of course is where I focus, but it's also just a really inefficient, ineffective, and insecure way to provide yourself regular energy. You know what always comes up? The sun always comes up, right? And you know it's always warm? The core of the earth is always warm. And if we were able to decouple our energy production systems from the interests of major corporations that have done everything they can to protect this ineffective, inefficient, deadly system of energy production, we not only would have more secure access to the energy that we all need, but we wouldn't do so at the expense of our children's future. And to me, that just seems like an obvious bet. This framework that I write about in Healing Politics is the notion that if you want to understand our politics right now, it is almost impossible to understand them without recognizing that people have a deep and profound anxiety about their future. And that anxiety is driven by a recognition that the systems that we have relied upon to deliver us the basic means of a dignified life have stopped doing that a long time ago. Instead, we've sold them off to the highest bidder so that they can profiteer off of them at our expense. And of course, you can't profit off something unless you exclude people from it. And so we find that these access to things that used to be public goods that we all probably agree are public goods, like basic healthcare, we find them behind a paywall that is getting increasingly large and tall, and also increasingly ornate, right? It hits you on the back end rather than the front end. And that's to all our detriment. And it leads to this collective anxiety, this epidemic of insecurity that I write about in the book.
Yeah, and a justice-centered framework that we've seen in the Green New Deal resolution has addressed a lot of these things in ways that have really excited me. As someone who's worked in public health, like, what have you made of seeing a Green New Deal and all of the new proposals for a better, more clean energy future?
Yeah, let me just step back and answer that question in a different way. I want you to think about the life of a little boy in Detroit, a little girl in Detroit. Think about the fact that right now, the air that they breathe, every time they take a breath, every time they do the simple thing of doing what we all have to do to stay alive, they are sucking in the pollution of a major corporation right down the street. Now, their parents have to work minimum wage jobs. Oftentimes, because those communities have been over-policed, you're talking about one potential breadwinner in the household. And oftentimes, because of the eviction epidemic, those homes are overcrowded. And you think about the schools that those kids go to that are underfunded because of the legacy of redlining. That is the state of play right now. And you think about what the Green New Deal is, right? The Green New Deal is not simply a climate legislation. It's also a jobs legislation and an infrastructure legislation wrapped into one. It allows us to invest in rethinking the very buildings that those kids go to school in to make them energy efficient. Allows us to invest in the jobs that those kids' parents work to guarantee them access to a high-paying, union-represented job, and then solves the problem of the pollution coming out of the smokestacks that those kids have to breathe every day. That is how the Green New Deal works. And to me, you're right, it is a justice-oriented, but also it's a people-oriented approach to solving a set of problems that are mutually interlocking and have to be addressed that way. And I think that's what's so profoundly incredible and meaningful about legislation like this.
And it got very strange. We had a power outage here, so I think we're
Oh,
all
no.
good. And
Well,
we've got the separate
I
tracks
recorded
anyways.
the answer on my
Yes.
side, so you'll have it. So you can just cut this little interlude out.
Yeah, this is just for us to interface, so that's great. Sorry for the break there.
No, there we go. Broken infrastructure, man. Do better.
Well, you're so brilliant. It seems like there's literally nothing that you don't know. But I mean, you just in your podcast, you're remarkably curious and you investigate issues. And I love the episode you did last week on environmental justice because it's digging into these exact issues. And as someone that hosts a podcast, if we're not talking about justice, we're doing just a horrible disservice to the environmental and climate movement. You had an incredible guest with Catherine Coleman Flowers on the show last week. As someone who hosts a podcast, like, what have you been wanting to dig into more when it comes into environmental justice?
Yeah, no, I appreciate you saying that. I'm perpetually a student, and I find that learning is a function of asking good questions, not knowing a lot of information. And I think we do our disservice to ourselves when we stop asking good questions because we think we know something. And I think that is the spirit of podcasting, right? So you get to have people on your show and ask them all the questions that you wish you could ask them. I kind of feel like a 6-year-old kid just getting to ask really smart people questions about how the world works. You know, people who know a lot more about it than me. Yeah, I'll tell you, the thing about environmental justice that I think is so critical is that sometimes we do ourselves a disservice by talking in terms that are coded rather than allowing the stories and the narratives themselves to take the limelight. And so much of what I think is so powerful about the medium is that you can bring someone on and ask them about their story and tell them to, or tell them that this is the space that, you know, that society meets the science, that meets the justice, and allow them to just expound. And I think we do a great job when we give folks like Catherine Flowers and so many other environmental justice activists the space to talk about their own experiences and to know that they'll be heard. And And a lot of what I'm trying to do on the podcast is to tell that story beyond, just the raw data, but to give it context, to give it a narrative and allow people to appreciate the humanity in the thing. Even science itself is a beautiful story. Every scientist, every experiment is a story. I thought this, I tried this, and I found this, and then I changed my thinking. I tried something else, and it is a narrative. And I think when we recontextualize information and words with narratives that created them, I do think that they take on substantially more power.
And in that episode, which we will link to, there's an incredible story that's told. So I don't want to spoil it, but people go listen to the episode. You just did such a great job with that. I want to take a step back and talk about health professionals, because you talked about your journey, how you came to care about the climate crisis. How do we get more people who maybe they work in healthcare, but they haven't been in a public health position where they've maybe seen some of these intersecting issues? How do we get more healthcare professionals to care about the climate crisis?
I think you'll find that a lot of health professionals care a lot, but they don't necessarily see the connections between all of the people that they see in their clinics and hospitals. And I think that there is a movement now in public health thinking that inspires people to move out of their clinics and ask, how is the world in which people live and learn and work and play, how is it shaping their lives? And how does that then feed into these moments that I get to see them in a clinic or a hospital space? And I think when clinicians are inspired to see the world and see their patients as a collective, it points to what we call upstream features of their experiences that need to be addressed. The other thing is that I think we haven't been good as health professionals at grabbing the mic, at telling our own story. And it's inspiring to see so many more health professionals on camera in front of a microphone telling their story, because I think their story needs to be heard, because when they speak on behalf of their patients, and they speak about these broader upstream features that are impacting so many of them. And then the last thing I'll say is that it's getting worse and worse to be a health professional in America. The experience of giving and receiving healthcare in this country has been so eroded by the corporations that dominate our healthcare system. And I do think that it's really important for us to appreciate that slowly changing systems like climate change are really hard to ascertain over time. There's this classic paradox in Greek philosophy called the Sorites paradox, which is, how many grains of sand do you have to take off of a heap of sand until you can no longer call it a heap, right? And that's the question, right? That there's a Sorites paradox of the American opportunity dream, the American dream, right? Like, how many opportunities do you have to take away until we can no longer call this place the land of opportunity? And I think that falls pretty hard on healthcare professionals who are asked to do more and more with less and less for people who are sicker and sicker because they just don't have access to healthcare. And so, I think the care is there. It's just that the space to share the platform with the world and to talk about their experiences and the erosion of those experiences, and more importantly, the erosion of those patients' experiences have been missing. And I hope that more folks can grab that mic and take that platform and share their experiences, because they are so powerful.
Absolutely. And I think, we obviously talk about the tragedy of the climate crisis, what's happening now, what's already happened, and our fears for the future. But it's also, when we think about solutions and what is possible, you can get really excited, especially about the impacts it could have on public health. So let's get excited for a second. When you're hey, when you want to just grab somebody by the shoulders, and in times when we could actually do that before we had to all stay apart, what gets you excited and say, hey, you should be excited because this is possible? What are those things in public health?
Well, look, number one, Medicare for all. We weren't going to get through the conversation without me saying those words. Look, at the end of the day, we have the potential, we have the opportunity, and we have the public commitment to Medicare for all that we need. And it's only a matter of time. And I hope that folks who are frustrated with this moment see that as a light at the end of the tunnel and are willing to work for that. Number two, the Green New Deal. I just think that this is such a sweeping change in the way that we understand how we need to be moving as a society that I think it's extremely powerful and ought to be harnessed and invested in. And you see movements like the Sunrise Movement, which I'm really proud to be affiliated with, and in a number of other youth-led climate movements that are showing the real power of investing in this approach. And then lastly, there is a recognition that it's not just the outcomes of our politics that ought to motivate us, but it's the system of our politics that ought to change as well. And I think we're seeing a new crop of elected officials, whether it was people like AOC and Rashida and Ilhan and Ayanna in 2018, or it's folks like Cori Bush and Jamal Bowman in 2020, who are showing the potential for a politics that truly is people-oriented rather than power-oriented. And so there's a lot to be optimistic about. I'll be honest with you, I believe in hope, but I don't believe in the kind of hope that is empty. I believe in hope that turns into righteous action. And it's the righteous action that I put my investment in. And so I think we need to be hopeful and optimistic, but that hope and that optimism can't leave us sitting on the couch. It's got to get us off our rear ends and out to do the work. And I'm really grateful for all the young folks out there. And the thing I'll tell you, and I'll tell them, I'll tell everyone, is that right now we are in a struggle to save the very democracy on which we can fight to achieve the future that we want to build. And I know a lot of folks are frustrated about the outcomes of the primary, as was I. But we don't have a choice. There are a lot of folks who don't have the privileges that we have, right? If you have extra time to be able to put into this work, go put it there, because there are a lot of folks who don't. And we owe it to those folks to center their well-being and do the work of getting Joe Biden elected and then turning around the next day and holding him accountable. I don't believe that there's any inconsistency with believing in Medicare for all and a Green New Deal and making sure that Joe Biden gets elected in this general election and then turning around and continuing to push for those things, because they are our future. We have to build them, and we got to turn that hope into righteous action. And sometimes it means, rather than going straight forward, you got to take a cut to turn again. If that's what that means right now, then fine, I'm willing to cut, but I'm never going to lose my view on what needs to be done, why it needs to be done, and the people for whom we're getting it done.
That's incredibly well said. And, what I've been so excited about with this younger crop of progressive politicians is that they are doing what has been, studies have shown, like, makes a difference on Americans' opinions on climate action, which is they are tying these to other issues, including healthcare. I mean, the studies show that that works better. And are you seeing, and beyond the Green New Deal, are you seeing this group of progressive politicians able to do that, able to communicate that as lawmakers to the American people?
One of the things that I've come to appreciate about politics is that, in the end, politics is about translating culture into policy. And so many of our new crop of progressive leaders, they're extremely good culture makers. And though they may never cast the deciding vote on an issue, they are out there moving these conversations in the public and forcing that conversation forward. And in the end, that's what's going to move our policy, right? And they'll be right there to translate it. And so I think, oftentimes it's easy as young people to, especially in a moment where, you can post something on Instagram, you got instant likes, right? Instant validation, to forget that history is long, and sometimes it's sweeping, and sometimes it doesn't happen as fast as we want it to. And that doesn't mean that we shouldn't be impatient to make it happen. But that also means that we need to keep toiling and never give up on it. And I feel really good about this crop of new leaders and their ability to stick in the cut and keep doing the work until we get there.
And I tell you what, if anyone is in the fight doing the work, it's you. So thank you so much for all the incredible work you're doing. The book's Healing Politics, the podcast America Dissected. I'll link to them in the show notes. So anywhere else our listeners can find more of your work online?
Well, I'd encourage folks, follow on Instagram and Twitter, but I'd encourage folks, stay tuned in February. Got another book coming out with Dr. Micah Johnson called Medicare for All, A Citizen's Guide. I hope folks will check it out.
Fantastic. Well, Dr. El-Sayed, thank you again for joining the Climate Pod.
Yeah, thank you so much for having me. I appreciate you.